Today's topic of discussion is anatomy of tongue. I am Dr. Mohammad Sharjeel Ilyas, Assistant Professor, Amiruddin Medical College, Postgraduate Medical Institute, Lahore. Objectives of today's topic are to learn functions of the tongue, anatomical parts of the tongue, most important, mucosa of the tongue, especially special mucosa, extrinsic muscle of tongue and their actions, intrinsic muscles of tongue and their actions, neurovascular supply and lymphatic drainage, and most importantly, clinical anatomy. The tongue is a muscular organ situated in the floor of the mouth. It is associated with the functions of sensation of taste, mastication, deglutition, speech during the oral cavity. Anatomical parts of the tongue is divided into an apex or tip of the tongue. The central part is body, and superiorly it is called dorsum of the tongue, and the posteriormost part is the root of the tongue. The root is attached to the styloid process and soft palate above, and to mandible and the hyoid bone below. Because of these attachments, one cannot swallow the tongue itself. The superior part of the tongue or dorsum of the tongue is divided into two parts. Anterior two-third of the tongue, which is called the oral part, and posterior one-third of the tongue, which is called pharyngeal part. The green colored sulcus represented here in the picture is called sulcus terminalis. Actually, this sulcus is the one which separates anterior two-third and posterior one-third of the tongue. This is a V-shaped sulcus, and the limbs of V where they meet, they represent a foramen which is called foramen cecum. The future thyroid gland or thyroid diverticulum just arises from this foramen cecum during embryological life. The posteriormost part of the tongue is connected to the epiglottis with the help of three folds of mucous membrane. These are median glossoepiglottic fold and two lateral glossoepiglottic folds, right and left. The area between the median and lateral glossoepiglottic folds is called a valleculae, and the area is lateral to the lateral glossoepiglottic folds is called piriform fossa. Posterior one-third of the tongue contains majorly lingual tonsils. The inferior surface of the tongue contains a median fold which is called frenulum. On each side, lateral side of the median fold frenulum, there are openings of submandibular salivary ducts. Lateral to the frenulum, there are two lateral folds which are called plica fimbriata. Mucous membrane of the inferior surface of tongue is a normal mucous membrane which has not specialized structure. While this mucous membrane of the superior part or dorsum of the tongue contains different projections which give the interior two-thirds of the tongue its characteristic roughness. First of all, there are velate papilla just anterior to the sulcus terminalis. They are large in size, 1 to 2 millimeter in diameter, and are 8 to 12 in number. Each papilla is a cylindrical projection surrounded by a circular sulcus. The walls of the papilla have T-spurs. On the lateral side of the tongue, just in front of the velate papilla, there are certain papillas which are called foliate papilla. Histologically, there are fungiform papilla which are numerous near the tip and margins of the tongue, but some of them they are also present scattered over the dorsum. These are smaller than the velate papilla but larger than the filiform papilla. Each papilla consists of a narrow pedicle and the large rounded head. They are distinguished by their bright red color. The filiform papilla or conical papilla cover the presulcal area of the dorsum of the tongue and give it a characteristic velvety appearance. They are the smallest and most numerous of the lingual papilla. Each is pointed and covered with keratin. The apex is often split into filamentous process. There are two pairs of muscles which comprises this muscular organ, which is called tongue: extrinsic muscles of the tongue and intrinsic. In the picture, I'm showing you extrinsic muscles of the tongue. First of all, genioglossus in the blue color. Main function of this muscle is depression and extension of the tongue. The origin: it is from upper genial tubercle, from the mandibular symphysis, from inside. Insertion: there are three types of fibers. Upper fibers insert into the tip of the tongue. Middle fibers to the dorsum of the tongue. Lower fibers to the body of the hyoid bone. Functions: respectively, upper fibers retract the tongue. Middle fibers depress the tongue, and lower fibers protrude the tongue. This is the only muscle which majorly act the function of protrusion. A dissected picture of genioglossus muscle having origin from symphysis of mandible, upper genial tubercle. Second one is hyoglossus. Function of hyoglossus mainly is to depress the tongue. Origin is from greater corner of hyoid bone. Again from the hyoid bone. Insertion: the side of the tongue. They are shown in green color. Function: they retracts the protruding tongue, main retractors of the tongue, and also they depress the hyoglossus muscle from the greater corner of the hyoid bone towards the side of the tongue. Next muscle is styloglossus. It creates a trough for swallowing. It basically helps in swallowing. They are shown in purple color. Origin from the tip at the anterior surface, part of the anterior surface of styloid process. Insertion to the side of the tongue. Function: they retracts the tongue, pulls it upward and backward. Fourth and the final muscle related to the extrinsic muscles is palatoglossus, and this is the muscle which initiates swallowing. Origin from palatine aponeurosis. Insertion: descends in the palatoglossal arch to the side of the oral cavity to the side of the tongue. It pulls up the root of the tongue to close oropharyngeal isthmus. So it initiates swallowing. This is another picture of palatoglossus muscle covering the palatoglossal arch. Now there is turn of intrinsic muscles of the tongue. The first one is superior longitudinal. It arises from the submucosa of posterior tongue, posterior part of the tongue, and lingual septum. Actually, the tongue is divided into two halves, equal halves, by a fibrous septum which is present in center, and this is called lingual septum. These superior longitudinal muscles insert into the apex or anterolateral margins of the tongue, so covering the whole superior surface of tongue. Action: shortens the tongue and makes its dorsum concave, like this. The next one is inferior longitudinal group. It rises from the root of the tongue and body of hyoid bone. Insertion in the apex of the tongue. Action: again shortens the tongue and makes it dorsum convex, just like this. The third group is vertical. It arises from the root of the tongue and genioglossus muscle. It inserts into lingual aponeurosis, and action is broadens and elongation of tongue, just like this. Now this is the final member of the intrinsic muscle group, that is transverse group. It rises from lingual septum and inserted into the lateral margin of tongue. Action, it narrows and elongates tongue. It's like this. So this is the summary of intrinsic muscles: superior longitudinal, superior located, inferior longitudinal, inferior located, while transverse and vertical, they are in the midway. Blood supply. It is derived from the tortuous lingual artery, a branch of the external carotid artery. Venous drainage from two dorsal lingual veins and deep lingual veins. They combine to join the lingual vein and then into the drain into the internal jugular vein. Lymphatic drainage from the tip bilaterally to the submental lymph nodes, from the dorsum uh, unilaterally to the submandibular lymph nodes, then behind the sulcus terminalis, or including the circumvallate papilla area, to the superior deep cervical lymph nodes. The nerve supply. This is the most important portion of this whole topic, as this is a pet viva question. So we have two nerves here, hypoglossal and lingual nerve, which is a branch of mandibular nerve, which is again a branch of trigeminal nerve, the fifth cranial. So, wholly the motor nerve supply of all the muscles are from cranial nerve 12, hypoglossal nerve, except one, palatoglossus muscle, which is from vagus nerve, cranial nerve 10. While the sensory supply, we have anterior two-thirds, which is supplied by lingual nerve, which is a branch of trigeminal nerve, mandibular branch of trigeminal nerve, and it gives sensory supply to the anterior two-thirds of the tongue. While the special sensory supply, the taste, these fibers are carried out by chorda tympani. And chorda tympani is a branch of facial nerve, but actually the lingual nerve carries the fibers of the chorda tympani just to help them to reach the tongue, anterior two-thirds of the tongue. While the posterior one-third of the tongue is supplied by the glossopharyngeal nerve, both sensory and taste supplies. This is a clinical situation which is called tongue tie, where the frenulum is attached anteriorly to the floor of the mouth. Uh, a little surgical procedure is required to free the frenulum from the tongue. If there is a problem in hypoglossal nerve, this situation occurs, which is called dysarthria. It is a condition when the muscles that a person uses for speaking weakens, or it becomes difficult to control those muscles. Thank you so much.